The first time you actually do something important that's right, it feels like all of the abuse that you suffer is worth it. Hi frenemas, it's me, Dr. Jake, the loudest and proudest gay doctor on YouTube.
It's my first day. I'm the man.
Could you go drop an NG tube on the patient in 234 and call the attending if the lavage is positive?
I don't know jack.
You're expected to do a ton on your first day of residency. But after med school, you've only learned the theoretical part of medicine. You don't actually know how to practice. My first day of residency, I wasn't ready to do anything, but I rose to the challenge. That's what you do. You're there to help patients and you do what it takes.
I became a doctor because I wanted to help people. But orientation yesterday, it didn't really focus on patient care.
The hospital doesn't want to be sued. Being sued is not a good thing.
In the United States, medicine is a business, which is something I thoroughly object to. Making money off of somebody because they're ill makes me ill.
If there is a mistake, don't admit it to the patient.
This guy's a scumbag. If you admit that you made a mistake to a patient, that's actually a good thing. You have a chance to apologize, and often that patient won't want to sue you because you did the right thing.
I'm Dr. Bob Kelso, and I'm your chief of medicine. I promise you, we're a family here.
I don't believe him at all. The less that authority figures know about what you're doing, the better. Even if it's a good thing, your supervisors in medicine are not your friends.
The medical interns are having a Pac-Man tournament.
I won a Pac-Man tournament when I was on vacation in residency. I got 4 beers. Oh, that's gotta burn. I am not a coffee person. I had not one single cup of coffee all through residency. I hate this stuff.
Elliot Reed, John Dorian? Great. 1, I am your resident, Dr. Jeffrey Stedman. Not Jeff. 2, here are your manuals.
There are some people like that in residency, but your senior residents are only a year or 2 ahead of you, so most of them are pretty down to earth. I don't remember having anyone who was that much of a tool.
I'm a tool, an unbelievably annoying tool. Finally, these are your beepers. From now on, they control your entire life.
I hate pagers, and I think medicine is the only field that has not upgraded.
Carla, can I ask you a personal question? Do you spray the perfume on, or do you just fill your bathtub up with it at home and splash around?
I smell nice.
He's funny, but in my residency program, that kind of behavior would have probably gotten you fired.
Just poke it through his skin. Poke it through, now!
Time's up. Carla, would you do it for him, please? I'm also going to need an ABG.
Most doctors haven't put an IV for like 10 years. That was always done by nurses because they're better at it.
Why has this Gomer got to try and die every day during my lunch?
It's a little insensitive.
Even if you think a patient can't hear you, you act as if they can. There have been a bunch of stories of people in the operating room hearing their physicians making fun of them, calling them racist things, calling them fat. Not a good look.
Ben's 92 years old. He has full dementia. He doesn't even know we're here. He is inches from Carla's rack, and he hasn't even flinched.
We don't necessarily know that patients with dementia can't understand us. Just because someone can't communicate with you doesn't mean that you should say nasty things about them.
Did you actually just page me to find out how much Tylenol to give to Mrs. Lenzner? Get her to open her mouth, take a handful, and throw it at her. Whatever sticks, that's the correct dosage.
Because I did pediatrics as well as internal medicine, I had to dose my Tylenol based on the weight of the patient. That was a struggle bus.
Dr. Kelso is the most evil human being on the planet and may in fact be Satan himself.
It's just that this isn't really what I expected, you know. Most of my patients are, older and sort of checked out mentally.
The patients that need the hospital most are the old ones who are really sick. We kind of expect everyone to live forever now, so we send them to the hospital.
That's modern medicine. Advances that keep people alive who should have died a long time ago, back when they lost what made them people. Now, your job is to stay sane enough so that when someone does come in that you actually can help, you're not so brain dead that you can't function, for the love of God. What?
We do our best on the patients who are older because we want them to do well, but really the reason that we go so hard on them is so that when somebody young comes in, who's vital, who has sepsis, who has respiratory failure, who got into a car accident, we can help them by being fully equipped.
Really dead.
Okay,
At one of the hospitals that I worked at, the opposite thing happened. A patient died but was still warm, and all the phlebotomists came in, they drew the patient's blood, and all the lab values were all over the place. They didn't realize the patient has died until the day team went to examine them. Even though it makes me fear the zombie apocalypse, I think this situation is preferable.
Surgical interns, they're all slice them and dice them. They're the jocks. Medical interns, we're trained to think about the body.
The best surgeons know when not to operate.
Door is broke. It'll be 5th time or so it don't open.
Maybe there's a penny stuck in there.
If I find a penny in there, I'm taking you down.
Never mess with a hospital janitor. Without them, the place cannot function.
The necrosis and infected stool most likely indicate what?
Sir, I have no idea.
Dr. Reed, can you help him out?
I'd say it's superior mesenteric insufficiency.
I think that happens much more in medical school than it does in residency.
Now just suck out the fluid with the giant needle.
I think this needle's too big. I'm gonna get a nurse.
Come on, man. Learn by doing. Learn by doing.
They're doing a paracentesis where you drain off the fluid from the belly, and I always do those with an ultrasound. Especially on the right side of the abdomen, you can hit the liver and cause a huge bleed.
What's it like being a young hotshot doctor?
It's like, did you ever go see a movie that everyone told you was great, and then because of all those expectations, you ended up totally disappointed?
Movies nowadays have too many special effects.
That's kind of how I feel about medicine too. That's why I'm here.
My first code. See, here's how it works. Someone's heart fails, they beep everyone. The first doctor in has to run the room, tell everyone what to do, basically decide if the patient lives or dies.
The first doctor in runs the code. They're in charge. They're at the foot of the bed yelling out orders.
Don't worry about the patient. Turk was already there, learning by doing.
Charge, clear!
Plus, it turns out the guy was just sleeping, attached to a faulty monitor.
Always check a pulse before you do CPR or shock somebody. Never trust the monitor.
Lose the clothes. Nice.
I would never sleep with somebody in one of those call rooms. I mean, they're usually cleaned regularly, but you don't know. And the last person in there was probably covered in poop or vomit.
You're worried about being on call tonight, aren't you? Look, worst case scenario, you kill somebody.
Being in the hospital at night actually is pretty scary for a new doctor. Staffing is a lot lower, so you're responsible for more patients. You just gotta get through the emergencies, but if there are 2 or 3 emergencies at once, there may not be enough people to deal with them.
You don't need to tell me how hard it is being a woman around here.
You're certainly furthering the cause by wearing a thong to work and hooking up in the on-call room.
Do you even know my name? And my thong? I happen to think it makes my ass look good.
Yeah, that's pretty much how I would have reacted too. Other people's sex lives are none of your business. Don't mess with the janitors and don't mess with the nurses either.
Hey, champ. First night on call starts soon, huh? Gosh, you must be excited.
You betcha.
That was a no.
Know not what I do.
Don't steal patient food. It used to be that you had to do these calls where you'd work for 28 hours straight, and by the end of it, you were just dead to the world. But even without working 28 hours in a row, working nights feels terrible. I quit working nights 4 months ago, and I feel like I'm still recovering.
He crashed. The attending thinks it was a pulmonary embolism.
The shame that all I could think about was how hard this was for me.
Time of death 0200.
Even if you do your best, it's going to happen. People die. But you always feel like you could have done more.
Hey. Yo, I lied before, man. I'm scared every second. It's a good thing they make surgical masks, because if they didn't, everyone would know that my face is like this the whole time.
Residency is scary. You're thrust into the hospital and expected to have a lot of independence. Yeah, you always have a supervising doctor, but sometimes you feel like you can't talk to them because they're your boss. If you show weakness, then you feel like you're a failure.
And like that, I got a second wind.
Oh no. The janitor.
I'm watching you.
Did you ask the Bursky family for permission to do an autopsy?
Sir, do you think I could skip just this one? Every story needs a good guy.
This can't end well.
Do you not realize that you're nothing but a large pair of scrubs to me?
He is the worst kind of person.
If he's the jerk, then who's the good guy?
Car accident, crashed in the elevator on the way up.
We gotta relieve the pressure in his chest.
And there's the young guy they were talking about, the one they can actually save.
Okay, connected, please, Carla.
Normal rhythm. That's enough.
Sorry. It's a very big moment for me.
Yeah. I don't know why that made me tear up. But the first time you actually do something important that's right, it feels like all of the abuse that you suffer is worth it.
The most important thing is that I got through my first 3 days without looking like a complete idiot.
I have done that. Bye-bye. Bye-bye. See you in the next one. Bye-bye.